today, India is marching ahead with a big vision of building a developed nation by 2047. And when we envision a developed India, health becomes an extremely important pillar. And India has unique challenges. Our vast and diverse population, rural and urban divide, and also the dual burden of non-communicable as well as communicable diseases. So when we look at these unique challenges, it becomes extremely important that we make use of technology. And we have had a comprehensive technological integration in our national healthcare framework, which we don't see as only adoption of technology, but a strategic response to the unique challenges that we have. And today, we have integrated AI in the entire health continuum. So from disease surveillance to prevention to diagnosis to treatment, it's everywhere. And it shows the power of AI in bringing about a transformation. I have a couple of examples of the AI tools that we have used. So, firstly, in media disease surveillance system, that's one of the AI tools we have been using. This is a tool which has helped us to monitor digital news in as many as 13 languages and then make disease alerts. And this helps us to generate real-time data alerts for the disease outbreaks and showcases the strength of AI, the power of AI in augmenting our efforts towards disease control and enhances our surveillance capacity. In India, we also have One Health mission now. Under this mission, the Indian Council of Medical Research has also launched an AI tool which surveils the genomes and predicts the zoonotic outbreaks before the transmission actually takes place from the animals to the humans. And I heard one of our experts, panelists talk about the use of the adoption of AI-supported handheld X-rays in our TB screening program. So we have brought this technology closer to the community by deploying these AI-enabled handheld X-rays in our intensive TB elimination efforts. And there are other solutions. There is Cough Against TB, which has generated a 16% additional caseload. And this includes the asymptomatic cases, which were till now out of the system's reach. Similarly, we have the prediction of adverse TB outcomes. This tool has also contributed to a 27% decline in the negative treatment results. And today in India, considering the fact that we are a very huge population and it's a low resource setting, so we have to look at solutions which are scalable and which are frugal and which address the systemic gaps instead of focusing on solutions which could be more suitable for the resource-rich health settings. So there are many examples of how we have used different AI tools for bringing about transformation and strengthening our efforts towards inclusivity in healthcare. And AI cannot be taken forward unless we have a supportive ecosystem. Friends, today we also hear that there is a great amount of debate going on about the use of AI and what impact it is going to have on our clinicians. So, there are a significant number of doctors and clinicians who are convinced with the strength of AI, but then there are also fears that AI might be a threat to doctors and clinicians. AI could replace, and I feel that these fears are largely misplaced. Because AI is here to augment. AI is here to assist. AI cannot replace the clinicians. At the most, what it can do is, and that will be in a positive way, it will reduce the burden of the doctors. The routine, high-volume tasks will be carried out by AI, and the doctors or our specialists can focus on the complex cases or clinical decision-making. And the non-specialists, they can also benefit from AI, because they will also be elevated in their roles and they will also operate at the top of their expertise. So there are several benefits that AI brings to our medical fraternity, and the fears that the AI could ever replace clinicians, that are not really true. We must never forget that medicine is not just a science. Medicine is also an art. So when a treatment proceeds, healthcare thrives not just on algorithms. Healthcare thrives on human touch, on empathy, on compassion, on communication between a clinician and a patient. And this human touch can never be provided by AI. It is only a clinician, it is only a doctor who can communicate with his patient and provide that compassion and empathy that is needed by a patient. So what the doctors need to worry about today is AI literacy. Now, our future-ready clinicians need to be AI literate. It's a necessary skill which is now needed for all our doctors worldwide, and especially the global south. So I urge all the members of the medical fraternity who are present here today to spread this message that AI cannot compete with clinicians. It can only compensate for their absence. And our doctors and our clinicians need to be AI literate. And I'm very happy to mention that the National Board of Examination in Medical Sciences in India, it has very recently launched an online training program on AI in healthcare for our doctors all over the country. It's a 20-hour special course through which they will be introduced to the fundamentals and the benefits of AI. Another aspect which is more important is when we talk about a greater use of AI in healthcare is the ethical use, the responsible use. And for that we need very strong regulatory frameworks. In India, we have created those robust regulatory frameworks so that AI is used ethically and responsibly. We have the Indian Council of Medical Research, which has come up with guidelines on the ethical use of AI. And also because AI can never be held responsible for its decisions, but humans must be. So our national regulator, CDSCO, is now working on developing the guidelines for the use of AI and software as a medical device and also software in medical device. During this AI India Impact Summit, we will also be launching our strategy for AI in healthcare for India. This SAHI, or the strategy for AI in healthcare for India, will be like a national guidance framework for all our states, for all our regulators, for all our private programs and actors, public programs, rather than a prescribed centralized mandate. And it is proposed to be released during this AI India Summit on the 19th of February. I'm also very happy to say that India, because of its continued commitment to responsible and ethical use of AI, has also recently joined the Health AI Global Regulatory Network as a pioneer country, and it is collaborating with the UK and the Singapore and contributing to the sharing of safety protocols. And this ensures that the vast experience that India holds in digital health innovations can now contribute to establishing safer global standards for all. So all I wish to say is that innovation excites, but what's important is endurance. It's important that we not just innovate, but we also incorporate it in our national policies, national programs, and also in the everyday work habits, work culture of our clinicians, So our medical fraternity has to be AI literate. It has to be updated with the newest AI-based tools which are coming, and they should be used very responsibly as well as very ethically. That is what, and safely. That is the most important thing. So with this, I would like to thank you all once again for having me here. And I only wish to urge all the participants who would be present for the discussions that will continue, that we have to come up with recommendations which will provide us more scalable and frugal innovations which will be able to address the global challenges.